our next speaker. Title of the talk is Changing the Culture of Academic Medicine, Perspective of Women Faculty, and it's Linda Pololi. Yes.
Thank you. So after this marathon morning, thank you for continuing to sit here. It's certainly an honor to speak with you, and I've very much enjoyed the presentations and speaking with so many of you individually since yesterday. I'm Linda Pololi. I'm from Brandeis University. I spent most of my career in academic medicine in this country, and just the last 7 years at Brandeis. And my career in medical schools really focused on the personal and professional development of medical students and then of faculty. And at Brandeis, I've really been fortunate to be able to delve more deeply into what I experienced and observed over 25 years in academic medicine, and to study the culture of academic medicine and how that impacts particularly our faculty in our medical schools and teaching hospitals. So why is this group important? There are approximately 130,000 medical faculty in the country, split between the basic sciences and the clinical sciences. And that's the only place that we train physicians for the nation. Many of these faculty lead the country in biomedical research and discovery, and they also practice at the highest levels of clinical care, often to underserved populations. So I think they're a very important group of people to look at and see what's happening to them. So I'd like to tell you just very briefly this morning about this. We're now, I guess, at the end of our first 5 years of this research project, the National Initiative on Gender, Culture and Leadership in Medicine. It's more familiarly known as Sea Change for culture change. And it's an initiative that addresses the imperative that we've heard about of developing women and underrepresented minority faculties' full potential and leadership in academic medicine. And the project has engaged medical schools in action research to actually put in place change so that all faculty can contribute fully. So just a snapshot, maybe some of you don't know, this is a broad audience, a few statistics, but you'll see even over 30 years ago, already 30% of medical students were women. So you can see there's a very large, highly trained cohort. For over 10 years, it's been more or less parity in our medical schools. However, with this backdrop of training, only 4% of the medical faculty are female full professors in the country. In the average medical school, about 131 medical schools in the country, there are 35 female and 188 full professors, male full professors per school. 12% of women medical faculty achieve full professorship, compared with about 30% of their male counterparts. You heard from Nancy Andrews, approximately 10% of our deans are women. That changes a lot because when one comes or goes, that percentage moves quite a bit. But only 8% of the department chairs in the clinical sciences are women. And it's a little better in the basic sciences, 13% of basic science chairs are women. So there's been a 30-year commentary about the lack of advancement of women in academic medicine. You know, we're squandering our training resources, you know, what's happening to the women that enter medicine. And these are the main themes that really emerge as a sort of an explanatory model that has been put forward, that women are distracted by their children and that impacts their performance. They leave the faculty, they're less ambitious to be leaders, and they need to develop certain skills to make them equally competent with men. It's really a skills deficit model that has been proposed. So we've really taken a rather different approach to this. We figured that there were an awful lot of well-intentioned, smart people trying to address this issue, and that these explanations really didn't cut it for us, didn't explain the situation and the intransigence, really, of the situation. So we've undertaken a series of research activities over the past 5 years. It takes a long time to do this work. As Jeremy Berg was saying yesterday, it takes a long time to build a rigorous body of research around an issue. So our first phase of our study was to interview men and women faculty at different career stages in a consortium of 5 medical schools that gathered around, with their deans, gathered around this project. And then we followed this, we had very sobering findings in this qualitative study. And so we constructed a quantitative survey, and we now are analyzing the data, and I'll show you a little bit of the data from a national fielding of this survey. And basically this qualitative work and this quantitative data together really document the experiences of faculty in our medical schools, and they really document the organizational culture that we have. And then concurrently, as this was an action research, we always intended that our research data would be put to use, would help facilitate change. We developed a so-called learning action network among these 5 schools, the deans of the 5 schools, leadership within those schools, as well as some junior faculty, a purposefully diverse group of people that came together twice a year for 2 days. We formed a collaborative community of learning in this group that was very wonderful. And we put in place data action cycles, or the schools put in place data action cycles in their schools. They took our research data and said, what does this mean? What should we do to address what we're finding? They developed promising practices. They studied promising practices elsewhere. And through this process, we have developed a number of so-called sea change practices that facilitate culture change, and I still do a lot of that work. So the first step in culture change is really to observe closely what's going on. So that's what we did really in our interview study. And I really wanted to have a few direct quotations from faculty that are very representative of what we heard from men and women faculty, actually. And I thought maybe it would be very nice for you to read these, because they actually represent the voices of the faculty. So could we have the microphone? It's not just a job. The teaching part is wonderful and new. The clinical part, the patients are very exciting, and it's rewarding to have them and to treat them. And in terms of research, the results can benefit your patients. There are a lot of good reasons to be excited and enthusiastic about doing this. Doing academic medicine, you make an impact on the future physicians of America. Would you like to read? Would you like to read? You need the microphone.
I had my own lab. There was an unbelievably driving passion to answer questions in a way that I would be adding to the information that would make children's lives better. I saw that for me, clinical care was never going to be enough in medicine. I needed to take my intellect, drive it as far as I could, and then for me that meant getting support, doing experiments in the laboratory, presenting my results, and getting published to get the information out.
For instance, it didn't value diversity or the experiences of women or the voices of women. Women's issues are very important to me, and the contribution that I think women can make to intellectual idea exchange. If that's important to me, but it never gets brought up, it never gets heard. Or it's just women are invisible. To the extent that it's an environment that the leadership allows, it becomes unattractive to me.
I'm most successful in my work when I'm actually at the bedside. Yeah. When I'm at the bedside with a learner, I feel like I'm giving out. I'm giving in a way that you can only give if you're with the patient. You're with a learner. That's when I'm most gratified.
But in an academic institution that doesn't value community, culture, partnership, collaboration, I wouldn't have wanted to stay there. That's where I was going and what I valued. It was really a dead end.
I wasn't driven by the self-promotion that I think has come on in academic institutions. So that self-promotion becomes more important than the work. All of a sudden, they lose sight of why they're doing what they're doing. It's all about getting new grants. It's a club of, I have more than you, and I'm the expert in this. So it's a little bit of an unreal self-promoting kind of environment.
Women are chosen less often for these types of leadership positions, meaning a chair position. I think that definitely women are less nominated for awards, grants, etc. I think that that might be because the senior people who are nominating people are mostly men. Men tend to nominate men, and women tend to nominate women. I don't think it's conscious at all. I think it's very subconscious.
And there were colleagues of mine to whom power meant a great deal, and I watched them become people I didn't like as they dealt with this hostility and grabbed for the power, and they achieved a great deal, and I don't take it away from them, but in the course of it they lost their humanity. They became people I could no longer respect. They became dishonest and manipulative.
So, based on that and a lot of other sobering data, we constructed a survey. Thank you for reading. I get very upset when I read these quotations, so I try and, it's bad enough listening to them, but reading them is even worse. So we constructed a quantitative survey. We fielded it in 26 medical schools, the original 5 sea change schools, and then a stratified random sample of 21 additional schools. Then we within each of those schools, we fielded it to a random sample of faculty drawn from across the schools, basic and clinical sciences. We stratified by age, and we oversampled women and faculty underrepresented in medicine, as we were particularly, we wanted to very clearly hear the voices of those groups. And we collected a lot of demographic information that's very important in the analysis of this very rich data set we now have around the respondents, so the sex, race, ethnicity, career type, type of school, whether they're researchers or generalists or subspecialists, whether they worked in the basic science or clinical sciences, their principal roles, whether they're predominantly researchers or educators or clinicians, and their leadership roles, and also their research focus. And so we have approximately 2,400 respondents and their data. We achieved a 52% response rate, which is actually very good for medical faculty. Half of our respondents are women, 24% from underrepresented minority faculty, so these are very unique data sets. There aren't any comparable data sets out there. 72% physicians, 28% PhD, EDD faculty. We've done very rigorous analysis of this data. So one of the things we've done is a factor analysis, and that has allowed us to identify 12 dimensions or scales that are each of these environmental scales, so-called, is really a dimension of the culture. And you'll see in the right-hand column the Cronbach alpha coefficients. They're very high, which means that these scales are very reliable, very rigorous indeed, unusually so. And I'll just give you some glimpses of some of this data, which is really very interesting. So there was a scale about being energized by one's work, about self-confidence in one's own ability to advance in career, the feelings faculty have about trust, inclusion, belonging in this workplace, in this community, being connected to colleagues. Interesting dimension around values alignment. That was the alignment of faculty's personal values with the values they see rewarded in their institutions. And then another very interesting dimension is ethical moral distress in faculty. One of the predominant themes in our qualitative data were feelings of ethical or moral distress and actually being adversely changed oneself by working in this culture. Leadership aspirations, perceptions of equity for women, perceptions of equity for underrepresented minority faculty, career life or work life integration and how the institution supports that. And then perceptions of whether the institution is actually making a good faith effort to improve either in terms of women and minority faculty or to support faculty generally. So I've just sort of selected one or two items from just a few of these scales to show you. So, for example, we do find that 92% of, this is male and female faculty, find their work to be personally satisfying. 76% of faculty feel energized by their work. They find a lot of meaning in their work, but 41% of faculty say they feel burnt out. Values alignment, about half the faculty say that their institution's actions are well aligned with the institutional mission statement. About half the faculty, just over half the faculty, say that their own personal values are well aligned with the institutional values. And 50% of the faculty say that the administration is only interested in me for the revenue I generate. And then in terms of ethical moral distress, 82% of, this is men and women, there was very similar percentages, say you have to be a self-promoter to get ahead here. Of 25% of the faculty say the culture of my institution discourages altruism. 22% of the faculty say I find myself being more aggressive here than I like. So we also asked faculty about their intentions to leave in the prior year. This very worrying data. We know that there are very high attrition rates in academic medicine as tracked by the AAMC. But 35% of faculty said they seriously considered leaving their current institution due to dissatisfaction. And you have to understand that these numbers are in addition to an alternative reason that they could say they were leaving because of personal family reasons or due to retirement, which was personal family was an additional 6%. This is just due to dissatisfaction. 21% of faculty is seriously considering academic medicine altogether due to dissatisfaction, and there was no gender difference in these numbers. But we did find some gender differences in our data, and I guess what's really interesting is that we can now, we've done the work, we can see which of these scales actually predicts faculty attrition. And we have that work under review, should be published very soon, which is very, very important information for medical schools, as the cost of faculty attrition are just enormous. Some people say it's 5% of the budget of an academic medical center, quite apart from all the other untoward effects of faculty turnover. So around self-efficacy, women have lower rates of self-efficacy in career advancement than men, which really bothers me a great deal, how these highly accomplished, successful women still have lower levels of self-efficacy. Only 50% of women feel that advancement is as open to me as to anyone else, as opposed to 63% of male faculty. 57% of women feel confident that they can overcome whatever professional barriers they may encounter. 67% of men agree with that statement. Relatedness and inclusion. 31% of women faculty say they feel ignored or invisible here, compared with 21% of male faculty. There's a lot in our data about distrust and dishonesty in the culture. There were a lot of questions that focused on that very specifically. Here we have similar findings in men and women. I often feel the need to hide what I really think and feel. 34% of women say they feel isolated, and so do 26% of the men. So it's a very non-relational culture. Needless to say, to this group at least, there is a huge disparity between the awareness of men and women faculty regarding perceptions of gender equity. So 60% of women say it's harder for female faculty to get ahead here than for male faculty, whereas only 21% of male faculty have the same perception. Oh dear, something's. Can you do something about that? Will that just? Oh, okay. No, it doesn't. That doesn't work. All right. So 43% of women agree with the statement the institution treats women and men equitably with respect to promotion. 71% of faculty, of male faculty, believe that. And then you'll be pleased to know that we found absolutely no gender difference in leadership aspirations between men and women faculty. And that we did find a little difference between perceptions of institutional support for career life integration, but it actually isn't that big between men and women faculty. Certainly doesn't explain the statistics at all. For example, 60% of women say it's difficult to succeed here without sacrificing personal and family commitments. 51% of the men say the same thing. So we've published a lot of our qualitative data, which is readily available. I guess I recently had a book published that really goes into much more depth about the research in a lot of these areas. But I guess basically what our research teams saw that. We thought that these four myths that I showed you earlier really didn't explain the situation for the lack of women's advancement and for the lack of advancement of underrepresented minority faculty in our medical schools. We saw enormous enthusiasm in women for the power of cooperation. We found a rejection in women for destructive individualism. We saw great courage in women about staying true to their conscience and wanting to make change for improvement. And we saw again and again, we heard about women's desire for a rich professional life. That was an overwhelming message we received from the faculty. So what could be the way forward? You know, Jane Addams felt she could harness the power of women to make change in politics in this country. And I think that we should really harness the power of women and people of color to make change for healthcare in this nation. I think Francis Collins last night, he failed to point out that we really need diversity of intellectual thought and diversity of perspective to really do the research and give the healthcare to the nation that our diverse population demands. So I think what the nation needs and what our healthcare system really needs are more women and people of power in leadership, and that would benefit the country and it would benefit the world. So thank you. I guess I should just say that our work has been very generously funded by the Macy Foundation. We did, in fact, receive pilot funding for a very early series of interviews I did from the Sloan Foundation. So thank you, the Sloan Foundation that are here today. And I'm here representing a wonderful research team. these are some of the, this is our website, some of the people from some of our 5 medical schools. So thank you.